competency-based medical education. I want to ask a couple of questions, and obviously we only have 5 minutes. This time I muted my phone. Is the current system creating the doctors that are holding? When you go to the doctor, when your friends go to the doctor, are those the type of doctors that you or your friends or the country needs? Is the current system designed to create the doctors Armenia needs? I see a big no from front. It wasn't me. And if not, how do we design that system? How do we do that? What does it look like? You've probably guessed by now that my answer to both of these is no. But the exciting part is the third part, because it is in fact possible. We can design the system to create the doctors that we need, to have a healthy population, and there is a way to get there. So we need to think about creating that system. In our program, it's pediatrics. I'm a pediatrician and an internist by training, so this is half of my training. But we need to think about competency-based. So we need to think about not just training that you can tell me Angir or memorized what you've read, but can you apply it? And can you apply it in an effective enough way that it changes the health outcome of the patient, the family, and that community, and the larger population? So we want to develop pediatricians, or let's think of, if you think about this larger, take it to any subspecialty, who practice evidence-based, patient-centered care with a systems approach and who are lifelong learners and teachers. And that bottom line is fundamental. We do not stop learning. The second we stop learning, we are doing ourselves and our communities a disservice. I'm going to very briefly talk about the program because the most exciting part for me is at the very end. So we have our residents rotate through a number of different hospitals. They do outpatient, they do inpatient, they do community rotations. They go to the Women's Support Center, they learn about domestic violence, signs of domestic violence. They go to rural areas, they go to centers that specialize in autism, developmental issues. They see child and family centers, how with co-op, how social workers and speech therapists and psychologists can work together with the local doctor to improve the health. We do all of these. We teach basic quality. We teach about M&Ms, morbidity and mortality. We talk about the problems so that we can solve them. We are not embarrassed of problems. We talk about them so that we can improve them. They do case presentations. We have local and international speakers, and our exams have 4 components. We are based on the 6 American College of Graduate Medical Education competencies, which are not about what you know, but what you can know and do. Can you do it, right? And so our exams are not the conventional spoken, I ask you a couple of questions and you answer them. They have a practical component. Every single resident has examined my left knee. Every single resident that I have. They go through differential diagnosis, computer skills, find an article about this. How would you find an article about that? Find the article, now apply the information from that article to answer the question. We go through all of these, and they come to us with minimal skills. This is one of our biggest challenges. Our faculty and our residents have minimal skills when they come to us. They don't know how to examine a heart. They don't know a review of systems. We have a differential diagnosis. A cough is one diagnosis. I'm exaggerating a bit, but a cough has a differential diagnosis of at least 20, 30 different things, right? You should be able to do that and think clinically, reason through that. It's what do I need to ask? What minimal tests do I need to do? How do I get there? What's the most dangerous? What's the most common? How do I figure that out? What are my next steps in a logical way? We have a little bit of that issue with our faculty as well. What's more so, though, an issue is that we think about, in the competency-based, we think about learning and teaching differently. We don't think about it as, what did you learn, and then regurgitate. We think about it as a lifelong process. So I want to tell you a story. One of my residents, who's one of the very, very bright residents, one day after an exam, as you can imagine, the exams I give are very different than anything they're used to, said, Dr. Lorky, what is it that you want us to read? I don't know what to read, so I can take this exam. And I said, okay, you want me to say, read these books so that you can take this exam? She's like, yes. And I go, oh, I did it again. I said, there is no set of books. You want me to say that if from here to there you read these books, you'll get to the exam and you'll be a good pediatrician. You know, that's not how it works. There is no wall. It is an endless ocean. It is an endless, ever-changing ocean of knowledge and skills that you need. I tried to make this endless ocean of books here, right? You need to learn how to swim through that ocean. You need to learn how to get there, how to get on an island, how to think about it, what's good, what's bad. There is no wall. There is no 5 set of books. You need to learn how to learn. And that means that our teachers need to learn how to teach and how to think about knowledge. What is knowledge and what is giving good medical care? We need to be curious. We need to have critical thinking and reasoning. We need to solve problems, which means we have to admit that we have them. And we need to think about thinking. It's hard, but it is a shift in how we think about how we think, how we learn, and how we teach. This is how we get to medical providers, doctors, nurses, everybody else, who can provide the care we need to be a healthy nation. It's hard, but the good news is it is possible. And for those of you who nerd out like me on things like antigenic shift versus drift, this is an entire shift in thinking. It is not drift. It's not a list of check boxes that we say we did and now we've changed the system. It is an entire shift in how we think about education and learning. Thank you.